According to the CDC, methadone and oxycodone are the two most abused prescription opiates in the U.S. Methadone works directly on opioid receptors in your spinal cord by depressing pain impulse transmission, also causing central nervous system depression. Oxycodone inhibits ascending pain pathways in the central nervous system, which increases your pain threshold and alters the perception of your pain.
When opioid receptors on neurons in the spinal cord that carry information about pain are activated, it can inhibit the transmission of pain information to the brain. Opioids can also act on descending pain modulatory systems to reduce pain. For example, by binding to receptors in an area of the brainstem called the periaqueductal gray, opioids can prompt the inhibition of pain signaling in the spinal cord via a pathway that first synapses in the medulla.
Long-term effects of opiates can result in a physical dependence of the drug, which can turn into an addiction. Tolerance of the drug will build up and cause the user to take more to achieve a high feeling. Higher tolerance can increase chances of opiate overdose, which may result in death. As of 2017, the number of deaths in the U.S. caused by the use of prescription opiates was 17,029. The number of opioid-involved deaths in Louisiana was 184 times higher in 2018 than it was in 2012.
So who's at risk? Patients that have a chronic pain due to inflammation or dysfunctional nerves are at risk for prescription opioid addiction. Also, patients who have been prescribed painkillers after surgery, or if there is a family history of addiction. According to WebMD, prescription opioid abuse is common in young adults. About 12% of people aged 18 to 25 have taken them for non-medical reasons. Now, you may question, what reasons would they have to take a prescription opioid without a medical problem? The answer, experimentation. Young people enjoy experimenting new things, and they may try a painkiller to get high or as a stimulant to help them study better. Prescription opioid addiction can be noted in signs and symptoms. Symptoms that accompany prescription drug abuse include confusion, an increased dose required for pain relief, and poor coordination. Healthcare professionals can recognize signs of abuse if patients appear to be high, unusually energetic, hostile, or sedated. Another sign that can be noted is if they are requesting an early refill or continually losing prescriptions, so more can be written.
Evidence against long-term use of opioids for chronic pain is mounting. Continued use, especially at high dosages, is associated with serious risks. Before prescribing, thoroughly assess whether benefits for pain and function outweigh potential risks. Consider non-opioid medications like acetaminophen, ibuprofen, or certain antidepressants or anticonvulsants, and non-pharmacologic therapies like physical therapy, low-cost relaxation or coping strategies, or regular exercise. If you do prescribe opioids, always prescribe the lowest effective dosage. Daily dosages greater or equal to 50 morphine milligram equivalents, or MMEs, can double the risk of overdose compared to 20. And the higher the dosage, the higher the risk for addiction, overdose, or death. If increasing dosages, exercise caution and increase follow-up to reduce the risk. Reevaluate frequently for changes in pain, function, and mental well-being, including signs of addiction. If the patient does not experience improvement at 90 MMEs per day, consider tapering, discontinuing opioids, and optimizing other therapies to get your patient back on track.
Some interesting facts are that drugabuse.com stated that 3 out of every 4 heroin addicts reported that they were introduced to opioids through prescription painkillers. Truth.com stated that in 2012, every 25 minutes, a baby was born suffering from opiate withdrawal.
Interesting facts that I found on drugabuse.com was that although men are more likely to die from a prescription painkiller overdose, the percent increase in death from painkiller overdoses increased more than 400% among women compared to just 265% among men. Another interesting fact was that the majority of people do not get painkillers from a doctor, which increases the risk for misuse. So, where do they get them from? Well, one study found that 60% of people using opioid prescription painkillers get the drugs for free from either a family member or a friend.